Lots of patients ask me, how do we improve our pregnancy rates? Well, firstly, lots of new medications which are available nowadays. These medications are more potent and they tend to help stimulate the eggs more appropriately. Secondly, you have lots of supplements which are available nowadays which will make the body more healthier and will have better sperm quality and egg quality. Thirdly, there are certain types of equipment available. For example, Zymote. Zymote is a way how we process the sperms before we inject it into the egg. And this way we can reduce things like DNA fragmentation. That means we will avoid using an unhealthy sperm to inseminate the egg. Then the next part, you have the insemination part, or rather the fertilization part, where we use a procedure called the ICSI. This way we ensure that the fertilization has taken place. Subsequently, we tend to push the embryo to about day 5 or day 6 of the embryo life. At that time, we even can do things like pre-implantation genetic testing, where we take a small amount of cells and subject it to some chromosomal analysis. And that way, we can screen the embryo, the best embryo for transfer. We avoid things like Down syndrome and any chromosomal abnormalities in the embryo. And during the embryo transfer, we use things like assisted hatching, where we make a small hole around the embryo, which will allow the embryo to eventually hatch and implant easily on the womb lining. And at the same time, we even use something called the embryo glue. Embryo glue is a type of culture media that helps in implantation. So these are the few things that we do to improve our pregnancy rates.